Thank you, Mr. President. I am pleased to be here today with the Senator from the Commonwealth of Massachusetts and the ranking member of the Help Committee to address this important issue. You would think, Mr. President, after the health care debacle last week, the other side would have gotten the message, which is the American people didn't send us to Washington to take away their health care. In fact, when I think about health care in Colorado, I think about a sort of a circle that contains health care that people in my state are either getting or not getting. And some part of that is Obamacare, that's for sure, but a lot of it has nothing to do with it. And they're unhappy with the way our health care system works. They want more access than they have. And the House bill went in exactly the wrong direction from where they're interested in going. I'd like to work with Republicans and Democrats to solve that, but this afternoon, we're here once again because the resolution before us would slash funding for vital primary care, preventative and family planning services for more than 4 million Americans across our country, especially women and those in rural communities of my state and other states. Since 1970, this body has supported Title X funding to expand access to affordable health care for low-income men and women. We did that because we understood that it wasn't just the right thing to do. We recognized that it was a good investment. Each dollar invested in publicly funded family planning programs saved the government over $7 in Medicaid-related costs. The other side rails against Medicaid spending. In fact, they just had a bill that cut it by about $850 billion last week. But if they succeed on this vote today, Medicaid spending will almost certainly rise as a result of what they're trying to do. We supported Title X funding with both Republican majorities and Democratic majorities in the Senate. Now a narrow majority is trying to ram this measure through. This isn't supported by a consensus of Americans, Mr. President, and you know it's not. When Vice President Pence had to drive over here from the White House to cast a tie-breaking vote. Just yesterday, the Vice President was at a White House forum on women's empowerment. It begs the question, did he learn anything at the forum? It's easy for senators, apparently, to vote against health care for struggling Americans. And I wonder sometimes whether the reason for that is that we're not affected by this vote. That's doubly true when 51 senators, overwhelmingly men, vote to cut health care for millions of low-income women. The vote today has real consequences for Colorado. If this measure passes, it will threaten to cut funding for Title X health centers serving over 52,000 men, women, and teens each year. It will also risk funding for the over 20 Planned Parenthood clinics throughout Colorado that provide health care services to more than 86,000 men, women, and teens. Planned Parenthood is a critical part of Colorado's health care system, providing essential services in a quarter of the state's counties. And this support is especially vital for our rural areas. 2 weeks ago, I visited Alamosa and Durango, Colorado, where these health centers are some of the only places women can turn to for preventative care and family planning services. We should not do this. Pediatricians are against it. Family physicians are against it. Nurses are against it. But on the other side, we have a narrow majority voting to strip funding for vital primary and preventative care, including breast cancer screenings and HIV testing. I would invite anyone voting against this measure, including the Vice President, to come to Alamosa, to come to Durango, and to see what these health centers are doing in our communities. I invite them to come and meet the people they help, the lives they change. I urge my colleagues to vote against this measure. It will hurt many of our fellow Americans. It will hurt women in my state and particularly working people, and it should not pass. Mr. President, I yield the floor.